Recording. Brilliant. Thank you. All right. Well, I make 11 and we have a lot of great content today. So I'm going to go ahead and get us started. Welcome everyone in. For those just joining, feel free to share where you're joining us from as we get going this morning. We're happy to hear where you're from, how you're doing. Just come on in. All right, today is another Great Lakes ROTA RC presentation. Our webinar today is Recovery-Friendly Workplaces, and our session is being hosted by the Great Lakes ROTA RC's regional partner, UW-Madison Division of Extension. So we just want to take a minute to thank them for hosting our presenters today and for putting together this great presentation. My name is Amanda Kerr. I'll be your host. I'm the Regional Project Manager for Great Lakes ROTA RC. And I'm happy to see you all here today. If I haven't mentioned it once, I'll probably mention it a few more times. Before we get into the presentation, we have a few housekeeping items that we need to address. So if you hang with us, we'll get into those. First, we just want to take a moment to acknowledge our funder and our funding. We are a SAMHSA, Substance Abuse and Mental Health Services Administration grant. We do cover rural communities within the states that you see there, which are Health and Human Services Region 5, Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. Just a brief note to say that if you're not from those states and you're joining us today, you're very welcome to be here. We're happy to have you. Knowledge is open and we welcome everyone. For those of our partners joining us today, we're glad to see you back again. Our website is listed there. We will put it in the chat towards the end of the presentation so that you have all of those links available. But this is just a brief view of what is available through our website. More virtual education like this. We have more upcoming events in February and March. So make sure you check that out. You can get access to our to technical assistance requests, community toolkits and resources, news and updates from all of our major partners, as well as any funding announcements that are relevant to substance use, mental health, and rural communities. The other thing you can get access to is our newsletter. If you're not currently on the newsletter, we would advise you to get signed up. And again, we'll put that link available towards the end of the session. Within our newsletter, not only do we have regional highlights that focus on local, community, and statewide efforts, but we feature experts and specific content. We look at connections with SAMHSA, the transfer technology centers, and more. It also gives you an update on things that we have coming up as far as virtual education like this. So just a little push or reminder when these things are coming due. And lastly, as we prepare to listen and engage in the session content, I just want to take a moment to promote the use of affirming person-first language when discussing behavioral health disorders. So as we create an environment of that learning together, let us just create a learning space that is welcoming and safe for everyone. As a virtual learning community, we ask that all participants support non-stigmatizing, recovery-oriented language that can help reduce negative bias and promote engagement. So we invite your active participation from whatever space you are joining us from today, and we welcome you formally into the Great Lakes ROTA RC virtual learning community. Let me introduce you now to our three presenters for today's sessions. Tyler Mack is a community health coordinator in harm reduction from Hamilton County Public Health. Dr. Jen Park-Marock is a health and well-being state specialist at the University of Wisconsin-Madison Division of Extension. And Megan Rutherford is a project director from Vail Bridges to Recovery. I'm going to hand it over to Tyler to start our presentation.
Hello, everyone. Sorry, I was experiencing a bit of technical difficulty there for just a second, and I am uploading something to the chat now, which should help facilitate this discussion so I'm not constantly going in and out of different screens. If you could bring your attention to those two websites, pull them up and just have them handy, or, just have them on the ready if you decide to look at them later on. I'm going to share my PowerPoint here and then just confirm that we have full visibility, and then we'll get started. So Amanda or Jen, can one of you confirm? I see a thumbs up there. Okay, good. Yes. We should be good to go. All right, terrific. So my name is Tyler Mienick, and I operate the program Recovery Friendly Hamilton County. I hope to address Any questions or notions you might have about the program today, but if I forget to mention something or we don't cover it in the Q&A, you can go to the website that I listed in the chat, or you can scan this QR code here if you want, and it will take you to our website. So thank you for your time today, and I appreciate everyone being here. So getting right into it, I don't want to belabor everybody with a bunch of statistics because a lot of this are, things that we're very familiar with. But I want to talk about why a program like this, why recovery-friendly workplaces matter at large. So according to a study by SAMHSA, who was mentioned earlier, I didn't know that they were one of your funders. That's great to hear. They did a large national survey in the early 2020s. I believe this is taken from 2021, and determined that approximately 7% of the US adult population suffers from substance use disorder, which sounds like a relatively minor statistic, but it's a very large chunk of the pie. And these folks represent our friends, our family members, our neighbors, and more germane for the subject today, our colleagues. And again, according to a similar study, again conducted by SAMHSA, we have a good sense that approximately 60% and up of people who struggle with a substance use disorder are actively employed. They are in the workforce, right? We tend to have, if you're not in the behavioral healthcare field or you don't have any familiarity with substance use disorder, we tend to have these cliched notions about people who are strung out on the streets doing whatever they can to make ends meet. But the truth is that most people who are struggling with an addiction are actively employed, and are actively employed in a lot of industries that we are very concerned about, particularly those in the with a safety sensitive focus. And again, just another statistic from the National Safety Council, according to a study that they conducted, roughly 1 in 12 workers has an untreated substance use disorder, irregardless of industry. If you are curious about how your specific industry, specific workplace might be impacted, there's this great tool that was developed by the National Safety Council. If you want to take a picture of this QR code or go to it later, I'm sure that you'll get these slides subsequent to this presentation. You can actually determine approximately how much money your company loses each year as a result of unaddressed substance use disorder. And again, why we take time to not talk just about the economic impact, but just the great boon or benefit that people in recovery bring to the table. These are some statistics that I like to cite. People in recovery tend to be absent from work approximately 13.7 days fewer each year compared to those not in recovery, and 3.6 days less than the general workforce. They save employers an average of $8,500 annually in turnover, absenteeism, presenteeism, and healthcare costs, and generally save employers an average of $500 annually in healthcare costs compared to those not in recovery. So we'll get more into the black box of what my program is all about, but just for now, if I had to put it into a nutshell, my job is acting as a liaison or a bridge between all of the great resources that exist in my county to address substance use disorder and the workforce, right? Hamilton County, which is the county seat of Cincinnati, Ohio. I can't speak for anyone else in Ohio or across the country, but we are very resource rich and fortunate to be so. But we also happen to be very coordination poor. So a part of my job is taking that bounty of resources that we have and coordinating them for a client that doesn't really have the knowledge base to understand what's out there and how it's helpful for their particular agency. And then for those of you who aren't aware, recovery-friendly workplaces have been around for a while now. We are not the only one by any means. Recovery-friendly workplace, the model that we follow actually started in New Hampshire in 2018, and it was guided, administered, and still is overseen by the governor of New Hampshire, Chris Sununu. I think his term is up and somebody else has taken his place, but nonetheless, it's actually a governor-led program in the state of New Hampshire. The model that they created was very successful, very easy to replicate, and it has been replicated at this point over 30 times across the country with some minor and major variations, right? So we are one of the few county variants, but I'm proud to say that we're very well represented on a national national level. I'm a part of the steering committee for the new National Recovery Friendly Workplace Initiative. And we get a lot of credit for being a good standard for local initiatives to follow. And we have helped our state, the state of Ohio, adapt and run their own program, which is very nice. But I say all this just to say that there are programs all over the country. You may be located in an area where there is one that's already in operation, and you can go to recoveryfriendlyworkplace.com to see if there is one in your area. So I bring this slide up, and sometimes I regret not putting it at a later point in this presentation, but I'm going to bring it here to talk about the kinds of industries that we try to work with or prioritize. This is data. Again, I work for a health department. This program that I run is operated under the harm reduction division in a health department in Hamilton County. And we are very fortunate to have epidemiologists who are studying overdose deaths, among other diseases, outbreaks, what have you, in our community. And this study, or not really a study, but rather this data that you're seeing here is a reflection of the number of overdoses in our community between 2019 and 2023. And then according to those overdoses, the occupation of the decedent. So we're able to tell directly what our lost souls, unfortunately, what occupations they held at the time of their death. And what we're seeing locally is very, very reflective of both statewide and national trends. So even in your area, you're probably going to see something very similar, which is that employees in the construction, food and beverage, and production or manufacturing industries tend to overdose at a higher rate than any other industry. I'm happy to say that this data and other marketing avenues and just great connections that we've had have helped us build a base of employers that is now 67 and growing. Everyone that you see circled on this kind of guide here is in one of those impacted industries. So we're very fortunate and very happy that the majority, or not a majority, but rather a good chunk of the people that we work with are in an impacted industry. And we're also very proud that we've been able to work with a wide and diverse array of industries, ranging from companies that are 1 to 2 employees all the way up to those that are 8,000 employees strong. And looking at this list, even if you're not in the region where I live, you're probably able to recognize a good number of participants. Gorilla Glue, FC Cincinnati, we've got some very big names. It's been very cool. So I'm going to get into the black box now about what I actually do to offer these businesses these resources and how it is that they're kind of taking advantage of the things that we have and what it is that we're offering them and what they're doing for us in exchange, right? So very little of what we offer is formally required. Most of it is optional, and everything comes cost-free. We are funded by the CDC, and I've gotten lots of supplemental grants throughout the past few years just because of how popular programs like this have become. Linkage to care. So one of the things that we prioritize with our program is we like to make sure that our employers have let their employees know where they can go for support if they need it. Most companies have an existing EAP, and that's terrific, an employee assistance program. We're not trying to replace that. We only supplement it. And the way that we supplement it is we have partnered with a local helpline that is also a 24/7 nonprofit treatment agency, and we have our own private extension to their 24-hour network. So we're able to advertise that helpline with all of our constituents and have it on posters in the ground floor of all the companies that we work with, and then be able to track the data on how many people were getting connected as a result of them having the awareness through Recovery Friendly Hamilton County. I don't have it posted right here. I'll see if I can send it in an update or a follow-up email, but we do require all of our businesses to put posters up on site for their employees to be able to see a lot of resources that they can use locally for support. One of them is, again, that proprietary helpline that exists solely for us. I actually just made a connection to it this morning, and I'm happy to say that since it's been in existence, we've had a good number of people get connected with services directly through their awareness of being recovery-friendly employees and a recovery-friendly employer. So designation/promotion, if you go to our website, and we'll talk more in just a minute about what we require our businesses to do to get all these great assets. But if you go to our website, you can see all the companies that have joined. And that is a bit of social currency for those companies. We want them to be proud of achieving a recovery-friendly designation. So we want them to be able to display that to the public and to display it to their employees. So we're putting it on our website. We put it on all of our social media feeds. We give our companies the ability to put it on their social media feeds. We've had some do press releases. We have some companies that have put our logo on their website. We have some that are even putting it in their signature line for their employees. So it's been very neat to see them really take this anti-stigma campaign, if you will, to the next level by really signifying not only to their employees, but also to the public that they are a recovery-friendly employer. So we're going to breeze through some of the optional stuff just to make sure that I can stick on time. Training/consultation. We offer our employers a very wide range of trainings that we hold both on-site, virtual, and hybrid. We've developed a lot of assets over the years with some supplemental grant money. One of our most requested trainings is a reasonable suspicion training and how to manage that with care. We also just recently put together an expert panel where I was able to bring together an employment lawyer, a physician, and an HR specialist to talk about what it means to be a recovery-friendly workplace, and that is accessible on YouTube for anybody that wants to see it. We do require all of our employers to take an initial orientation to learn about all the great things that we do, but then after that, everything is open to them as optional. Recruitment, this is really cool. So for our employers who take this plunge to become recovery friendly, we actually have an avenue for them to signify that to the job seeking public. If you go to the second link that I sent you in the chat, you can pull up a website for what's called the Workforce Innovation Center. And the Workforce Innovation Center is a leg of our Regional Chamber of Commerce. They have a very popular career board. And on that career board, they built a filter for our companies to be able to show that they have achieved recovery-friendly designation. And then we, in turn, are able to advertise that among the recovery community of Cincinnati. So we can go to our treatment providers and our recovery housing facilities and say, hey, there's this link to this website. It's a job board. And on that job board, you can see which companies have said that they are recovery friendly and have tried to put in place some of these practices and procedures to cater to people who might struggle with addiction. Next up, and this is probably our biggest thing, and this is what we're most known for across the country, we have a very robust, very comprehensive policy and procedures package that we give to all of our employers free of charge. This past year, it may have been 2 years ago at this point, everything is kind of a blur. We got a pretty nice supplemental grant, and I used all of the money to hire an HR specialist through SHRM and a licensed employment attorney, as well as an addiction psychiatry specialist. And we put together a very robust policy package that covers everything an employer would need to know about handling drugs and alcohol in the workplace. It touches on subjects from reasonable suspicion to managing a second chance protocol to how to do fair and equitable drug testing, all the way up to how do we manage work events where there's alcohol involved. It really touches on everything and includes worksheets and everything that an HR professional would need to be able to get that up and running in a matter of days, as long as they consult with their own admin team and legal. That is all free of charge. We give it to all of our constituents, but we also have shared it broadly across the country. So if anybody wants it, I'm happy to share it with you. And then just kind of rounding out here, I don't want to spend too much time on it, but we offer connections with social services if employees are struggling financially. We have a bounty of harm reduction supplies because, again, I work for the health department, so we've got Narcan out the wazoo, and we not only encourage our businesses to carry it, but we then have a policy and protocol package that we're giving them to help them be able to administer it in a way that is legally sound and that makes them feel safe, because the private sector is big on making sure that if they're going to have something like that, they're following all ethical guidelines and all legal guidelines to make sure that everything is kosher. And then in our state, if you're in Ohio, this applies to you. If you're not, I'm sorry, because it is a really cool program. But our Bureau of Workers' Comp actually has a program that reimburses companies up to 100% for doing some different recovery-friendly things. Those include trainings with third-party vendors, drug testing, and then being able to do policy revisions with a lawyer if they're willing to adopt second chance or fair chance policies for employees who test positive. So again, great program through our Bureau of Workers' Comp. They've got several $1 million that are still as of yet unspent, and it's all designed to reimburse companies up to 100% for doing some of those recovery-centric things. So that's the kind of cart, if you will, of services that we offer. That's our big menu. And in order for them to gain those services and gain our designation, this is what they have to do. Very brief, very simple, but I also think it has a good amount of teeth to it, right? Number one is they have to send us a letter of intent saying that they want to join and that they understand what the program consists of. We have a standard template for it, so they don't have to reinvent the wheel. But a leader, like the CEO or head of HR or somebody that can make a decision in the company that's big, has to send us a letter saying they want to join. Number two, they have to go through training with either myself or my colleague, Kevin. And that training is designed to discuss the basics of substance use disorder and then also give them a wide understanding of the spectrum of services that we offer so that they know what they can solicit from us at any time. Number three, and this is a big thing, they have to then in turn openly declare to all of their employees that they are becoming recovery friendly and what that means for them. And then at that time, share those resources that we talked about earlier. So through whatever channel they use to communicate with their employees, whether it's email, Teams, newsletters, whatever, they have to make an announcement that they're joining us and they have to give us proof of it. And then they have to put up those posters that I talked about earlier with all those resources. And then once a year, we check in to see if they are making any adjustments to their policies based on the guidelines that we suggest. And then once a year, they also have to do a reminder to all of their staff about their status as a recovery-friendly employer. Again, I work for Hamilton County Public Health, even though Recovery Friendly Hamilton County is a standalone kind of initiative. It's not like its own nonprofit. We are a part of a health department. The way that we track data is pretty broad. We, on all those posters that I mentioned earlier, we have flow codes where employees are able to scan them to access resources locally. And we can actually track data on how many times those are being scanned. And I'm happy to say that that number is in the hundreds. So we've had like 300 or 400 scans. We have our own helpline, which I mentioned earlier, and we're able to track data on that. We don't get any specifics, nothing like that would be HIPAA non-compliant. We're just told, hey, in this quarter, you had 2 people call, you had 1 person call, you had 3 people call, whatever. Myself and my colleague both maintain our own kind of internal helpline, if you will. Employees are able to call us if they want. It's very rare that we get those, but we have had a handful of employees call us directly to get connected with services. And then we've worked with Ohio University to conduct a survey at the employee and employer level. Our response rates tend to be pretty low and we're trying to improve that. But what they've shown generally is that people like the program. They like what they've gotten into. They think that it has helped reduce stigma in the workplace. And they think that generally it does help with retention, morale, and other things like that. And then lastly, we have gotten a lot of recognition nationally. So we've won 3 awards. 2 were local, 1 was national. And we are being cited by NIOSH and the National Safety Council for the policies that we created. They share them on their own websites, and we do a lot of mentorship. So I have one specific mentee that I work with very frequently in upstate Ohio, but there are others across the country that have gotten our assets and that I've done technical assistance with. So if you are ever interested in starting a program like this or inspiring your leaders to start a program like this, we're always happy to share all of our assets and to offer technical assistance. I would not have been able to do what I did unless people did that for me, so we always like to pay it forward. And that is it. So going back to Amanda and Jen, I don't know how you wanted to manage QA, if you wanted to do it ultimately at the end or after each presentation. So I'll shift back to you.
I think it's best if we wait to the end to do it.
Sure.
Amanda, is that something that we should? Okay,
Yep, we can typically do that.
okay, great.
All right.
So Tyler, thank you so much for your presentation. Um, our I'm Jen Park Marak, as I was introduced earlier, the Health and Wellbeing State Specialist at the Division of Extension. I'm also PI on the ROTA-RC project, and we are training and technical assistants for rural areas, as Amanda mentioned. Megan, do you want to introduce yourself?
Yeah, my name is Megan Rutherford, and I'm the project director at Beal Bridges to Recovery that oversees the Recovery Friendly Workplace Initiative in Wisconsin.
So again, thanks, Tyler. He really laid the foundation for much of our work, and we are based on the same model, the Recovery Friendly Workplaces New Hampshire work. I mean that is they have provided, they and many others across the nation have provided so much support and help within our own work. After hearing about the work in Hamilton County, Ohio, you may be asking yourself, well, how can I do this in my small rural community, right? I'm assuming many of y'all are from rural areas, since this is primarily targeted to, the ROTO grant is primarily targeted to rural areas. Well, that's part of our presentation. We are currently working in a project in Marinette County. Marinette County is a small rural county in Wisconsin near the Upper Peninsula of Michigan. We're right on the border. One thing I do want to mention is that what's required, what Tyler mentioned, what's required for the Hamilton County Recovery Friendly Workplaces designation is very similar to what we are requiring, training, declarations, resources. One of the biggest differences, though, is that this project is run primarily through Beals Bridges, which is to Recovery, which is a recovery community organization, and also through Extension, which is the outreach arm of the university. We have a cooperative extensions in every state, and we work to provide research-based, evidence-based knowledge to communities. And also what we can offer is different, right? In addition to providing training and technical assistance, there are extensive peer support recovery resources, case management, job training, the option of having a peer recovery coach at your workplace in Marinette. And in Marinette, we have a community of practice for recovery-friendly workplaces themselves. So I think we want to talk a little bit about our organizations next.
Yeah, Beal Bridges to Recovery, as Jen said, is a recovery community organization under the umbrella of the Marinette County Group Home Association and supports individuals affected by substance use disorder in 2 rural communities of Wisconsin and Michigan. So as you can see on the map, those 2 little hearts there, we are very small. We have a very large geographical area, however. And of course, we have 2 states, which makes it a lot of fun. Bridges is a peer-led organization. 8 out of our 11 current employees are individuals with unique and lived experience with substance use disorder and are now committed to long-term whole life recovery. Our mission is to promote recovery and mental wellness through housing and support services. Along with the services currently offered, our agency is in the remodel or planning stages to open a National Alliance of Recovery Residents Level 3 certified recovery housing within the building in that picture. We were opened in late 2021 with an idea, a building, and 2 staff. This is a list of the support services we offer in our community and in our building. Bridges has grown to employ 8 recovery coaches, 2 case managers, and offers a 24/7 peer warm line.
So I want to go over Extension. Some of y'all are familiar, some of you are not, but we are the outreach arm of the University of Wisconsin-Madison. We teach, learn, lead, serve, transforming lives and communities. We are organized in 6 institutes: agriculture, community development. A lot of y'all are familiar with either the ag or the youth development, which is like 4-H, but there we offer so much more. We're also in geographical area. We're organized by geographical areas, primarily counties. So in Wisconsin, we have an extension office in every county. So you can reach extension through every county office. One thing I want to mention is that although our grant is initially focusing on Marinette County, through extension and then generosity of Beals, we are expanding this project to help all of Wisconsin. We may not be able to provide a peer coach at your workplace, but we can provide training and technical assistance to the entire state. And for example, tomorrow, our extension health and wellbeing educators will be attending a training about recovery-friendly workplaces so they can work to bring more of this to more communities in Wisconsin. And I know a lot of our educators are really, really interested in working with their public health departments, with their chambers of commerce and other organizations to bring this project to Wisconsin, more communities in Wisconsin.
So I'm going to talk a little bit about how we started. We started out honestly with what I thought was this genius and unique idea. And then I learned that people like Tyler have actually been doing this for a long time. For the reasons that Tyler mentioned, it is really easy to identify that if an individual in or seeking recovery does not have stable and meaningful employment, recovery, let alone meeting their basic needs, is very difficult. After reviewing a social determinant of health grant that showed up in my inbox, I started asking questions. I asked those already connected with Bridges, the individuals who are in recovery, and our local employers what their thoughts were on the idea. When it became clear that recovery-friendly workplaces were needed in our community, then I began to research. Once I started looking, I realized there were already a lot of other recovery-friendly workplace models, and that I actually didn't have a unique or genius idea at all. It is genius. It just wasn't mine. It is extremely important for those in rural communities to rely on and build upon the relationships that we already have. That thing that we all hate about our small town is actually really useful in this professional world. Our goal is to build a true recovery-oriented system of care in every facet of our community. So we have built partnerships with many different organizations, including treatment providers, law enforcement, medical systems, local recovery support groups, higher education, and local businesses. Because everyone in our community is affected by substance use disorder, it was really easy for them to buy into the idea. So when you're looking at starting this work, think about who's already in your network and ask them to join you. Everyone that you just thought of in that last slide of like who those partners are should all be given a voice at the table. A really unique and beautiful aspect of our recovery-friendly workplace model is that it is led by people in recovery. We believe that it is extremely important that people who are most affected by the problem are part of the solution. So pull your local recovery community organization in. If you don't have one, you still have a recovery community, whether that's support groups, treatment alumni, individuals who have voiced their recovery. Tap into those individuals. As Jen had mentioned before, you know, with the move to a Wisconsin-based model, we can't guarantee that 5 hours from here, we're going to be able to provide you with a recovery coach, but we are really looking at building up local recovery community organizations or recovery support systems in Wisconsin so that they can offer that support to those locations. After asking our partners, we began local focus groups where we heard from human resources, people in recovery, treatment providers, and higher education on why they believed recovery-friendly workplaces were needed in our community. We quickly learned, which no one is going to be surprised about, that stigma was the biggest barrier for assisting individuals. And then the other one is actually an underutilization of benefits. And a lot of that came from fear. So Tyler talked a lot about, or he brought up the EAP. Most businesses have it, but people are afraid to use it. So part of what we learned is we have to kind of help our employers to know how to communicate with the people who need support so that they can feel safe. Our extension partners were extremely helpful in supporting us with evidence-based resources and the support that already existed. And then we began to dive into meeting with other states and leaders around the nation. So as I mentioned, the recovery-friendly workplace model that was developed in Marinette was completed and evaluated by individuals in long-term recovery, which allows the individuals most experienced in the problems to develop the solutions. Individuals in recovery attend all of our focus group meetings, sit on our advisory board, and are the ones to do the training to our businesses. So the key is to never work harder than you have to, or to duplicate what already exists. The world of recovery-friendly workplaces is full of passionate and selfless people who are willing to share with you. As a matter of fact, we adopted our logo with permission of Massachusetts. The National Recovery-Friendly Workplace Institute is currently putting together a document on all state leaders who are willing to help you start this in your community. Although much of this is already done, you may need to make a few tweaks to meet the specific needs of your community. So for example, Ohio does amazing things. Massachusetts does amazing things, but they're not Northeastern Wisconsin. So some things have to be adjusted, but much of this work is already done. So as I mentioned before with partnerships, as I don't know if you can tell, but I'm very passionate about that, about using the people you have in your community to support your community. It's really important to find a champion. So the Northeastern Wisconsin Technical College was a champion of ours along the entire journey and was our first workplace to be certified. My model has always been to not fight naysayers, but instead give a bigger and louder voice to our community champions.
So you may be asking yourselves, well, you know, Tyler has like a grant. Megan and Jen have grants. Well, how do you fund this recovery-friendly workplaces? We funded it through, as Megan mentioned, the Community Impact Grant from the Wisconsin Partnership Program. The Wisconsin Partnership Program, if y'all get a chance to look, they fund so much great work that happens in Wisconsin. We are also funding it this year through some of the Great Lakes ROTA-RC project to provide a little bit more support to bring it to the rest of Wisconsin. If y'all need help, we can also talk about how our project, our Great Lakes Road RC project can help fund it in your area. Look for smaller grants. You know, Tyler mentioned smaller grants that has helped him move this work forward. Work with your partners. One of the greatest things that happened from this project is that we made such great partnerships with DWD, and they are trying to write us into grants. They have provided Megan additional funding for her organization to do more of this great work. Maybe not dealing directly with recovery-friendly workplaces with this project, but also adapting to it, right? Or providing different supports that we didn't initially think of for our project. So we're not supplanting, just to let y'all know. We're adding to it. We add more. So yeah, this is how we have funded it. We are happy and we are happy to help you find a way to fund your work. The biggest thing again is finding that champion, and you cannot fund a champion. You need to find a champion for your work. Thank you. Again, we're gonna Tyler, and we're gonna take questions, but you can reach our Wisconsin recovery funding website through our extension and our QR code right there. I'm always available at jenniferpark.wis.edu. And then Megan has some really long email with lots of M's in it, but it's there too. Okay. Do you want to start sharing again, Amanda, or would you like me to share?
Nope, I can pull it up.
Okay.
All right. Okay, so we hope that you enjoyed today's virtual learning session. I'm going to just close out some of the end of session things that we need to do, and then we're going to open it up to questions and that you might have for our presenters. So thank you for your patience while we go through that. Those of you who have been through a session before, you've heard it, so you know what's going to happen next. The first thing you see there is our feedback survey after each event. We ask participants to just engage in a quick feedback survey. It helps both Great Lakes ROTA-RC and our presenters learn how they can better serve you as our professional harm reduction community. As far as availability of session content, just a reminder again that in approximately 7 days or less, you'll receive an email with links to all the content through Great Lakes ROTA-RC's website. That all that content will be made available to those who attended and those who registered. So in the future, if you find that you can't attend a session, please make sure you register for it, and we'll try and at least get the post-event content out to you. Lastly, certificates of attendance will be made available to those who attended live today. And if you have any questions about those or about that, please feel free to email me directly. These links will get populated along with the survey into the chat here when I stop sharing. But we do have our website, our email, our newsletter, our Facebook, and our technical assistance request process. So all very simple and easy to access. We've got a lot of followers. We hope that you will become one of them. And lastly, as far as upcoming events, like I said, it's going to be a very busy year for us, as it always is. We like to deliver lots of content. We like to keep up with your requests. If you think of something that you would like the Great Lakes ROTA-RC to sponsor, please let us know. Coming up February 6th, we have Integrating Farmer Needs into Childcare Solutions being hosted by our partner, the Ohio State University Extension. And then on February 20th, Adams County, Wisconsin Task Force will be presenting on their efforts to implement opioid settlement funding. And that will be a shorter half-hour presentation, but you'll have the opportunity in both of those to do some Q&A with the presenters as well. So I'm going to go ahead and stop there, and we can go ahead and stop the recording. I'll pop those links in, and I'm going to open it up for Q&A with the presenters.